Hi there, my name is Dr. Dominic Rowley and I'm the Medical Director of Let's Get Checked. I'm here today to talk to you about prostate cancer. So what is prostate cancer? Well, clearly from the name, prostate cancer is cancer of the prostate. So what is the prostate? Well, the prostate is a small gland that's located just near the bladder and near the urethra, which is the tube that you pee out of. So the prostate gland is in the male reproductive system. What causes prostate cancer? Well, prostate cancer is a cancer of older men. So with increasing age, you have a higher risk of developing prostate cancer. Prostate cancer is also more likely in people who have a family history of prostate cancer, and there are some links to having a very high fat diet and the development of subsequent prostate cancer. But in most cases, it's related to age and a family history of prostate cancer. How do you test for prostate cancer? Well, prostate cancer testing is a slightly controversial area. It requires a number of different tests in order to outrule the presence of prostate cancer. One of the tests that we utilize is called a PSA test. PSA is a small protein that's secreted or released by the prostate gland. Now, this is an entirely normal protein. So every man will have some PSA levels in their blood, and as they get older, the PSA levels rise. It's only when they rise above a certain level that we would have a suspicion that the prostate gland is enlarged. But even if it's enlarged, we still do not know if it's cancerous or if it's enlarged for age-related reasons. So that's why the PSA is only one part of how to test for prostate cancer. The other parts include what we in medicine refer to as a digital rectal exam, and this is where a doctor places a finger in the back passage to feel the prostate gland to see if it's enlarged and to assess the surface of it to see if it's rough or smooth. If the doctor is still concerned, they may request an ultrasound of the prostate gland. As I've discussed, to test for prostate cancer, you need to approach it from a number of different angles. So the test that we offer, the PSA test, as I mentioned, is only one of those 3 or 4 different ways of testing for prostate cancer. Who should get tested for prostate cancer? Well, the testing guidelines are, as I said, testing for prostate cancer is slightly controversial, and there are many disagreements about guidelines. But the general accepted advice would be men over the age of 50 should get tested for prostate using a PSA is one modality or one method, but also men younger than 50 if you have a family history of prostate cancer, or indeed if you've developed symptoms of prostate cancer. So what could the symptoms of prostate cancer be? Well, they would tend to be what we call urinary symptoms or problems with your waterworks. So for example, if you find that you're getting up at night more frequently, if you find that when you start to pee, it's difficult to stop peeing, that you have what we call terminal dribbling, that you might dribble at the end of peeing, or that you might have difficulty starting to pee. They're all signs that there might be an obstruction around your urethra or your urinary tract. So if you have symptoms or signs of an enlarged prostate, then we would advise you to get tested, or as I mentioned, a family history, or if you're over the age of 50. If you're worried about prostate cancer, if a relative has prostate cancer and you're concerned, or you have signs or symptoms that you're worried about, please go onto our website, Let's Get Checked, speak with one of our nurses, and they can advise you about the best test that would be suitable to your needs.